and they do remain comfortably below the caution thresholds that we've set for our risk measures that we track every day. Certainly the speed of increase in these various metrics over the last few weeks is something that we and you have noticed and are not dissimilar from what we're seeing at the national level. Unfortunately, at this point in time, we're still seeing a relatively low number of deaths being reported, but we do know that deaths are a trailing indicator, so that could tick up in a week or two as we've seen some additional hospitalizations recently. It's been a while since we've talked about the global and United States context, but this is relevant, especially when we talk about things like what's fueling the rise in variants in the SARS-CoV-2 virus. So globally, around the world, we're now above 194 million cases and over 4,100,000 deaths worldwide since the pandemic began. Notably, this total increased by over 1.5 million people in the last daily report, along with 23,000 additional deaths. And here in the United States, we're now above 34,400,000 cases and just under 611,000 deaths in the United States. The daily change in those numbers had been falling quite dramatically, but in more recent weeks, those daily rates of change have started to move higher again across the country. Here in Minnesota, we reported 424 additional cases today, but I'll remind you that due to some changes in our reporting schedule, where we're no longer reporting on the weekends, the number I just gave you, the 424, reflects cases as of early on Friday. Our cumulative total is now 609,810 cases since the start of the pandemic. There were 3 deaths in the latest data report, bringing our cumulative total to 7,653 Minnesotans lost to COVID-19. Numbers from the weekend and on Monday will be reported tomorrow. Total beds used by COVID patients in our hospitals in Minnesota has been fluctuating between 90 people and about 110 people in the hospital on any given day for the past several weeks. But we have seen hospital beds in use increasing in recent days as well. On the vaccine front, our pace of vaccinations has actually been fairly stable for the last 3 weeks or so. We're now at more than 5,800,000 total vaccine doses that have been given to more than 3,100,000 Minnesotans at last report, as you can see on our public dashboard. This is the total of first and second doses. In terms of some of the key demographic breakdowns, among people age 65 and older, over 91% of that entire population has received at least 1 dose. And of people age 16 and older, we're now at 68.2% having received at least 1 dose. Now, roughly 95% of everyone who has received a first dose has gone on to receive the complete series if it was a two-dose regimen. At the last report, the pace of first doses for the 16-plus population has been holding steady at just under 2,400 first doses per week in the 16 and over population. If we stay at that pace, and we would absolutely love to see that pace pick up again, at the pace where we've been at in the last couple of weeks, we will project that we will reach the milestone of 70% of all 16 plus being vaccinated before the end of August. I'll just mention that 70% goal number is a milestone. It's not our end goal. We'll talk a little bit more about that as we go on here. As has been true for a while, we do continue to see pretty large differences in the vaccination rates for counties across the state. And what that means is that some parts of Minnesota are fairly well protected, but other parts are still extremely vulnerable, especially with the Delta variant now dominating case growth across much of the United States and here in Minnesota. And CDC officials have been sharing in their briefings in recent days, unvaccinated Americans account for the vast majority of COVID-19 hospitalizations and deaths at this point. CDC Director Dr. Walensky shared last week that more than 97% of the people who are entering the hospital for COVID right now around the nation are not vaccinated. And we're seeing similar patterns here in Minnesota. The problem here is very much a problem of unvaccinated people getting exposed to an extremely contagious and dangerous virus. That's what's driving the case numbers, hospitalizations, and deaths right now. And certainly over the last few months, we'd all been very relieved and very happy to see a persistent decline in COVID-19 case numbers. But that's unfortunately changed in these last few weeks. I think a lot of Americans and Minnesotans who've been kind of in a post-pandemic mindset have been surprised and I think newly sobered or again sobered by being confronted last week with headlines telling us that COVID-19 cases have nearly tripled in the United States over the last 2 weeks. I'm sure you've heard CDC officials and federal officials generally now referring to the dramatic case growth that's happening in the United States again as a pandemic of the unvaccinated. And we've certainly seen this in Minnesota with our definite increase in cases here too, although we're happy that our cases do remain below the levels that many communities are seeing. We were routinely seeing daily COVID cases falling below 100 new cases per day a month ago. And in just the last few weeks, we've headed back up again, seeing daily case totals above 100 and above 200 into the 300s. And even, as I mentioned with Friday's data, over 400 new cases. And that's just a sobering reminder that we're certainly not done with this pandemic, much as we would like to be. The Delta variant, which is significantly more infectious than the original strain, has become the dominant version circulating in Minnesota as well as in the country overall. Our wonderful epidemiologists at the Minnesota Department of Health now say that the variant, the Delta variant, is causing 3 out of every 4 COVID cases in Minnesota at this point in time. And that means trouble for people who aren't protected because they never got vaccinated. And cases among those who are fully vaccinated, the so-called breakthrough cases, remain very rare. We do know that there is a small but important subset of people with compromised immune systems who do not have as robust a response to the vaccine. But breakthrough cases, again, defining those, breakthrough cases are those that occur at least 14 days after people have had their second dose of the Pfizer or Moderna vaccines, or 14 days after the 1 dose of the Johnson & Johnson vaccine. And this is a statistic you've heard us say before, but it just bears repeating. It's really striking. Our most recent data, as of July 15th, 99.9% of Minnesotans who are fully vaccinated have not contracted the virus. 99.9%. You've heard us talk a lot about the concept of herd immunity in the past. And what that means is when the great majority of people in a community are protected against a virus, and that virus just doesn't have enough opportunity to spread from person to person. And in that situation, even those who are not fully protected, like, for instance, children under 12 who are not yet eligible to get the vaccine, or those whose immune systems can't build that protective wall, don't get sick because there's just not a lot of virus out there for them to catch. Unfortunately, even in Minnesota, where we have a higher level of vaccination than some other states, we have not reached a point of herd immunity. And in some parts of Minnesota, the vaccination rate's quite a bit lower than the state average, all of which means there's just a lot of opportunity still for the virus to infect people, particularly if you are unvaccinated. And besides the danger to individuals, which is no small thing, each time a person gets COVID, the virus has a new opportunity to evolve. Now, most often, those evolutionary changes don't lead to more severe problems with transmissibility or lethality. But as we see with Delta, sometimes the virus does mutate in ways that could evade the effectiveness of the vaccines we have and of the treatments we have as well. That's the concern about continued mutation and continued evolution of variants of this virus. So far, our treatments and our vaccines are holding up well, even against Delta, especially in terms of severe disease, hospitalizations, and deaths. But we don't want to give the virus any more opportunity to continue to evolve in ways that could potentially in the future be more troublesome than what we've even seen so far. And certainly one of the biggest challenges that we face now in Minnesota, as well as in the country at large, is that there definitely is a mindset that we're done with COVID. But it's more accurate to say that we're in a critical transition phase. A lot of progress. We're in much better shape. We have much better tools, including especially the vaccines, to fight this pandemic. But it's not over. We still had a lot of virus circulating. And the virus that is circulating more and more often is this highly contagious variant that is going to find those who are not protected and infect them at much higher rates. And we really all need to keep thinking about this and giving really careful thought to what we're collectively going to do about this and individually going to do about this. Because as we've said many a time before, our actions are going to help determine what the next phase of the pandemic looks like and how disruptive it will or won't be. For those who are eligible to get vaccinated but haven't yet done so, now is really the time to do it. Delta and the other variants that we see are real threats, and the risk for the unvaccinated and unprotected people is high, as we're seeing very dramatically in other countries and in other states here in the United States. You know, this is especially important if you're planning to take advantage of some of the fun things we do in summer, other big public gatherings like the state fair. Being vaccinated in advance of that is a great way to protect yourself. For those who are vaccinated but remain concerned about what we're hearing, we encourage you to stay up with current developments and current recommendations and data as it evolves, but do remember that the vaccines are very protective. Even among those rare breakthrough cases that we've reported, we've seen very few illnesses serious enough to require hospitalization. Again, reminding you of that 99.9% statistic of vaccinated people who have not gone on to develop COVID-19 after reaching full protection. As we hear more, though, about the Delta variant, especially from our federal health leaders, many people are deciding to take additional precautions to protect themselves and others, even if they're vaccinated. For instance, by avoiding crowded places, especially indoors, or by continuing to wear a mask in some situations. That's never a bad idea. And if folks are feeling like even though they're vaccinated, that they want that additional layer of protection, that is a perfectly reasonable choice to make. Now I'd like to turn it over to Chris Ersman to give some updates on some of the more specific issues that we've been tracking, and then we'll open for your questions. Chris?
Thank you, Commissioner. As Commissioner Malcolm said, we have concerns about the growth that we're seeing in COVID case numbers. And it must be emphasized that, like CDC has said, this is being driven by unvaccinated people catching the Delta variant, a variant that is looking to be much more easily spread than earlier versions of the virus. It's really a new thing that we're dealing with, not the same old COVID that you think of from a year ago. And we're hearing a lot of questions about breakthrough cases. And one issue we've been watching closely are the reports of an outbreak linked to Provincetown, Massachusetts. A large outbreak of COVID-19 has been detected in people who have visited Provincetown since July 3rd. Cases associated with this outbreak have been seen in other cities like New York, Washington, D.C., and there have been several cases detected in Minnesota. None of our Minnesota cases have been hospitalized. Since Provincetown is a popular travel destination and has hosted a variety of popular events and festivals in recent weeks, we're asking for help to encourage anyone who has recently traveled there to get tested for COVID. Unfortunately, many of the cases in this particular outbreak were vaccinated. So in this instance, we are recommending that everyone who has recently traveled to Provincetown get tested, even if you're fully vaccinated and don't have symptoms. Testing is important for helping to stop the spread of COVID-19 since someone could be infected and not have symptoms. But having said that, I want to reiterate this point. We have had a total of 3,800 and 86 vaccine breakthrough cases documented in Minnesota among over 3 million fully vaccinated Minnesotans. That's a breakthrough rate of less than 1%, and that's remarkable. It's actually less than 0.1%. The vaccines protect against COVID-19 disease, including the variants, and they're especially good at protecting against severe disease from COVID-19. To repeat a point that Commissioner Malcolm made earlier, CDC officials have pointed out that unvaccinated Americans account for the vast majority of COVID-19 hospitalizations and deaths. CDC Director Walensky shared last week that more than 97% of people who are entering the hospital for COVID right now are unvaccinated. That is a stark number that shows how important vaccination is, even now in the face of the Delta variant. I also want to acknowledge that we've been getting some questions about timelines for additional vaccine authorizations at the federal level. And in particular, we've gotten questions about booster doses. I just want to reiterate that any decision on booster shots will need to be based on data and guidance from the CDC. The ACIP, or the Advisory Committee on Immunization Practices, met to discuss boosters last week, in particular for immunocompromised individuals. There were no votes or recommendations that were made at that meeting, and any recommendations from ACIP would follow an FDA decision, either an amendment to the FDA's emergency use authorization or an amendment to licensure, which hasn't happened yet, although some of the manufacturers have submitted. So there would not be any recommendations coming for boosters until we hear from the FDA. ACIP did say that healthcare providers should talk with their immunocompromised patients about the potential for reduced immune response to the COVID-19 vaccine, and those patients should continue to follow prevention measures such as wearing a mask and physical distancing until advised otherwise by their healthcare provider. So we will continue to monitor that situation and the science as additional data are made available, and we will be ready to step up when the time comes for a booster recommendation. Another topic that we have gotten a lot of questions on is vaccine for children under 12 years of age. We hope to get word on an emergency use authorization for those under 12 in the coming months, perhaps toward the end of 2021, but we're continuing to watch for this. We have over time heard different things. We had hoped and heard that there might be emergency use authorization sooner, but now the word that we're hearing is that it's likely that that would not come until perhaps the end of 2021. So we will continue to watch for that. And as for the full FDA approval, meaning licensure of the vaccines, that is expected to happen toward the end of the year or into early 2022. And with that, I'll turn it back over to the Commissioner.
Thanks, Chris. I think we're ready to take questions, unless, Mike, you have anything else to interject?
No, I think we're ready. Operator, if we could start with questions, that'd be great.
As a reminder, to ask a question, you'll need to press star 1 on your telephone. To withdraw your question, press the pound or hash key. Our first question is from Jeremy Olson from Star Tribune. Your line is open.
Hi. So today we saw Mayo announce a vaccine mandate, although with an opt-out clause for workers. VA required vaccination for certain medical personnel, and then we've got New York and California issuing some public worker mandates. So there seems to be some momentum around the issue of vaccine mandates. Given that, I'm wondering if MDH is considering a mandate for state or health department employees, or are you considering advice to private businesses or even schools advising them to implement mandates? Where are you at on this?
Well, it is something, Jeremy, that we continue to look at and talk about, and I think you described it well. It's momentum that is, quite frankly, quite welcome on the part of employers and settings. Certainly, we encourage that. We applaud when employers do make that step. Healthcare employers certainly are in a position to play a real leading role here, and we appreciate that they are looking very seriously at that. So we will continue to evaluate it, and don't have anything that we are announcing today, but that is certainly something we're watching with interest to see how that evolves around the country.
Well, just for clarity, watching and having an internal discussion about whether to do it are two different things. Are you having any discussions about whether to implement it at the state employee level?
I think that there have been questions about under what circumstances that would even be an option. So I think more accurate to say we're sort of just in the analysis phase at this point. There are no discussions about specific recommendations, but it continued to be something that we look at, and we appreciate the leadership role that employers are taking in taking a look at this.
Thank you. You all chopped up a little bit. I don't know if you can hear me, but follow-up question about the Delta variant and why it's spreading. I mean, we still have more cases of the Brazilian variant numerically, but it seems to be all the concern is on the Delta variant. What do we know about why it's taking hold compared to some of these other variants of concern?
Chris, do you want to take that one?
Sure. Well, I mean, a couple of things. One is that, our case numbers when for instance, Alpha and Gamma or the P1 were really starting to take off, we were seeing much, much higher case numbers. So for instance, if we just look purely at case numbers, we would say that, Alpha continues to be the dominant variant that has circulated in Minnesota just simply because of the total numbers of cases. But when we look at Delta, what concerns us is it was only a few weeks ago that it represented, less than 1% of the cases that we were sequencing. And if we look to June 15th until now, it was 57%. And if we look at July, it is now 75% of what we're sequencing for variants. So what we're seeing is that overall, this particular variant is taking over in terms of the proportion of cases in Minnesota that it represents. Given the large number of cases that we had seen last winter, it will take a while and hopefully we won't get there because we don't want to see that same number of cases again, but it would take a while to sort of equilibrate with the actual number of cases. But as I said, the concern is that this particular variant has gone from less than 1% to over 75% in a matter of weeks.
Thank you.
Our next question is from Catherine Richard from Minnesota Public Radio News. Your line is open.
Sure. So you've said a number of times now that we know that the vast majority of hospitalizations and deaths are among unvaccinated people. But does this also include young children who can't get vaccinated right now? Is the thinking still generally that the virus is pretty mild for younger children, even with the Delta variant?
Chris, can you speak to that?
Sure. Kat, we have seen over time that the age of hospitalizations and deaths in our cases has really dropped. So in other words, early on in the pandemic, the cases that we were seeing, the deaths, the hospitalizations were in much older age groups, and over time, even from November to the winter months and now into the summer, we have seen a consistent reduction in the average age of our hospitalizations and deaths. Children continue to be more spared in general, but we've heard from colleagues in other states that they have seen more severe disease in children with Delta. So I think that on the whole, I think what's concerning is that we have seen the age of our more severe disease drop over time. So I think that, it's important for people to realize that we're not just seeing hospitalizations and deaths in our most elder population. We're seeing it in much more of the middle ages, and that we have been hearing about more severe disease in children with the Delta variant from our partners in other states. And their level of transmission is much higher than where we are at currently. And so it remains to be seen if we will see that same, issue with kids if Delta continues to spread in Minnesota.
So that's a perfect segue into my follow-up question, which is, we are weeks away now from return to school, which would coincide kind of with, maybe a bit of a surge around this variant. And yet we're hearing from the Department of Education that, it's kind of going to be up to local districts around masking and other COVID-related mitigation measures. Do you anticipate that anything will change around that? Are you advising the administration and school districts that they should be requiring masks for kids and social distancing?
Okay, Catherine, this is Jan. I'll start, Chris, and then you can certainly chime in. We are working with our colleagues at the Department of Education. As you know, the CDC came out with some guidance a couple of weeks ago that we've been reviewing and looking at, and we generally think that those recommendations are very, very appropriate. So we'll be saying more about that just in the coming days here. But I think as CDC is also advising that there needs to be local flexibility around this, and the recommendation from the CDC is that masking is still a very good practice, highly recommended practice for anyone who's not vaccinated, and that at the present time would include children under 12.
And just to clarify, do you anticipate this be a recommendation or like a requirement from the state down to the school districts?
Well, I think as we've discussed a couple of times before, with the end of the state learning plan, the safe learning plan, at the end of last school year, the requirement structure kind of ended, and so what CDC is talking about and what we're talking about are kind of science-based best practice recommendations that we think are, we really strongly encourage people to follow those recommendations, but at the present time, those are not in the context of mandates.
Thank you.
Our next question is from Steve Karnowski from Associated Press. Your line is open.
Yeah, hi. We're hearing some reports from around the country about looming expiration dates for vaccine doses, mainly Johnson & Johnson. Is that an issue here in Minnesota? If we got a bunch of doses in the stockpile that are going to expire, what's going to happen with them? And any thoughts about potentially tossing out all those doses when there's still a need for them?
This is Jan again, something that we've been watching very carefully and working with our vaccinator partners all over the state to try to manage the supply so that the older supplies are used first. Chris's team in our immunization section works really hard and is in constant communication with lots of providers to, essentially move products around so that the older products can be used first. That definitely is something to keep an eye on, and I think folks have done a really good job trying to minimize any loss of vaccine due to that. But Chris, maybe I don't know if you have a more quantified answer that you would give at this point.
Sure. Well, a couple of things. One is that we have not been able to order any new Johnson & Johnson vaccine into the state for a number of weeks because of concerns about the expiration date. CDC is hoping to have news about a possible extension. As you know, as we learn more about the stability of a particular biologic product, the manufacturer can request an extension from the FDA. in terms of expirations, and so that's something that is being evaluated. But at this point, we have about 30,000 Johnson & Johnson doses in the state, and so anyone that needs vaccine inventory is matched to a provider who has an immediate need, and then we move the doses around. And so in the last month, we've moved over 7,000 doses around the state to providers in order to utilize doses and minimize wastage. So our efforts represent a combination of using the doses that we have, moving them around, and then not taking in, obviously, any new doses, and then we'll be waiting to hear if there are any changes to the current expiration date.
Our next question is from Greta Call from Minneapolis. Your line is open.
Hi. Yeah, so we're starting to hear about breakthrough cases, and I think more and more people are starting to hear about them through their social circles as well. And I don't know if it feels like it's more common because people are so surprised that vaccinated people are getting sick or testing positive or not. But it sounds like from what you're saying, this isn't outside the realm of kind of what was expected given the efficacy of the vaccines. And so as far as we know, are there concerns that those breakthrough cases will be more prevalent if Delta spreads more and as cases, if they continue to increase, I guess?
Greta, this is Jan, and certainly invite Chris to chime in too. I think that's just a great example of needing to stay attuned as the data continues to build. At the present time, the data suggests that the current vaccines are still very effective against, certainly especially against severe illness and hospitalizations and deaths, as we've said a couple of times. But so there's not enough data yet to say, yes, there's an issue with greater prevalence, but that's certainly going to continue to be studied and looked at. Chris, what would you add?
Well, I want to acknowledge that we have been delighted with the effectiveness of the vaccines that have been made available against COVID, but we need to keep in mind that no vaccine is 100% effective. And, the data that I shared earlier, yes, we in Minnesota are tracking every vaccine breakthrough. We have a very thorough review of any vaccine breakthrough. And even with that very complete capturing, our data still show that 99.9% of people who have been vaccinated have not developed COVID, which I think is really, really significant. So the fact that we're seeing breakthrough cases, yes, we're absolutely monitoring it, and it's part of the surveillance that we're doing, but it's well within the range of what we would expect with a vaccine that is very effective, but obviously it's not 100% effective, and no vaccine is. And that's why, when we talk about being able to control the virus and getting more people vaccinated, part of that is because, the more transmission you have, the more pressure it puts on, situations where perhaps someone may not have developed breakthrough disease, but if you are dipped in a soup of COVID, it puts a lot more pressure on your immunity. So I think that, what we're seeing with the vaccines, they are still looking very good. 99.9% of vaccinated people are not getting COVID, and the breakthroughs that we are seeing are to be expected, and are kind of a result of the ongoing transmission that we're seeing, in the state, and the increasing transmission that we're seeing.
Thank you.
Our next question is from Bill Werner from Minnesota News Network. Your line is open.
Thank you. Commissioner and Chris, you saw this right from the beginning when we didn't have a vaccine available, and we had to take all of these measures to at least try to tamp things down until we got a vaccine. Now we're seeing a resurgence in some areas of Delta variants among the unvaccinated. Is it outside the realm of possibility that there might have to be some additional restrictions along the line of what we had earlier? I'm talking about statewide mask mandates. I'm talking about public gathering, public place restrictions, restaurants, bars, and additional school closures. This is a bit following along the line or taking questions from my colleagues a little bit further. Is that totally outside the realm of possibility, or is in some remote case, if this were to evolve the way that we don't want it to evolve, might that have to happen again?
Well, Bill, I think, as the governor has said repeatedly, we continue to try to look at the facts and see what's happening, what the situation is with the virus as things do continue to change. But it's clear that the best way to avoid having to go back to some of those more, kind of broad, sweeping, restrictive measures is to increase our rate of vaccination. You might have heard Dr. Fauci recently, and I think Dr. Walensky too, but Dr. Fauci expressing a great deal of frustration for the fact that, we're going in the wrong direction right now as a country, and it doesn't need to happen. But he refers to it as an unnecessary predicament that we're in right now because we're just not haven't been keeping up the pace of vaccination that we had, and we just had these pockets of vulnerability that we're very concerned about. So I think our main message just will continue to be the best way to avoid the return to some of those more restrictive measures is for us to just continue to make vaccine available, address people's questions, make it convenient for them, make sure they're getting reliable information from people they trust. And I do think that the spread of the variants is just giving a lot of people a reason to take another look and to maybe, consult with their healthcare providers or trusted others about getting the vaccine.
Commissioner, may I just, as a follow-up, I'd like to ask that just a little different way, because we've got, I guess, roughly about a third of Minnesotans 12 and over who have not been vaccinated, or not received one dose of the vaccine. And you mentioned we don't have herd immunity then with that kind of number still out there. Are we, if these Delta variants take hold, excuse me, is there enough potential momentum there to, cause some yellow alerts or maybe even red alerts with the hospital system and some of the other problems that we had earlier when we did not have a vaccine?
Well, I think that's really very much why we're continuing to emphasize that the time is now to get vaccinated if you're eligible and you haven't yet. And we've said this before, that we are in no small way in a race against time here, and now in a race against the variants in time. The best way to keep these variants from continuing to pop up is to suppress the rates of transmission overall. And that is a time urgent matter, especially as fall approaches and we have kids who are not yet able, under 12, not yet able to be vaccinated. The best way that we can surround those kids with protection is for the rest of the community to be as highly vaccinated as possible. So our message is one of encouraging people to get good information from people that they trust. Our job is to try to make the information available and work with our partners all over the state to make the vaccine available, get the vaccine deeper into communities. We've talked a lot about the fact that not all communities have had the same easy access to vaccine. So we continue those efforts of community-based vaccination projects, and that will continue. It's just such an important time, we think, in this sort of pivotal stage where things look like they could go one way or another in terms of whether the variants will continue to kind of overcome the walls of defense, or whether we can build those walls, higher to make sure that doesn't happen, which is certainly our preference.
Thank you.
Yeah, Commissioner, if I could add to that, I think that it's a situation in which it doesn't have to be a foregone conclusion. We can change the outcome if we take action and if we are making sure that we're getting people vaccinated. I mean, that could make a huge difference. So I think that's why, we talk about encouraging vaccination and then continuing to monitor the data. But it's definitely not a foregone conclusion. We do have the ability to change this by our actions.
If I may, and I'm sorry, I don't mean to monopolize this any further, but what you just said there, Chris, begs another question, and that is, have you got a number in mind? We're at 66 or whatever right now, 0.2, I guess. What number would you feel confident at in terms of vaccination rate among the population, 12 and over, or whatever age you want to talk about, such that we do have the walls of defense strong enough that there's really very little chance of going down this path again like what we went down at the beginning? Have you got any number that you're thinking about that might give you confidence in that area?
Well, I can tell you that I started out talking about an 80% goal, and we've set some interim milestones, but definitely one of the challenges is that it's wonderful that we reached 70% of our 18-plus population with having received a dose of vaccine, but I think it's also important to keep in mind that it can't just be certain segments of the population. We have to make sure that everyone has had the opportunity and has gotten vaccinated. So in my mind, my original goal had been 80% of our population vaccinated. And with that, I would then be interested to see at what level of disease control we have. But I want to be clear, there's not a magic number. I just know that where we're at is not sufficient at this point. And as I said, my original goal had been about 80% in my mind, and then to evaluate where we were at. I don't know if the commissioner had a different thought about that.
No, I think that's exactly right. And the whole notion of what number do you have to get to reach herd immunity is something that varies with the transmissibility of a virus, and that's part of the reason that you're hearing some epidemiologists, infectious disease experts say, the herd immunity level would need to be higher if we keep seeing these variants emerge that have greater rates of transmission. So it is a moving target, and as Chris said, there's no single magic number, but really, stopping the spread and snuffing this thing out to the degree possible before any more variants, kind of drive those numbers even higher would be really, really optimal.
Thank you both for indulging my questions. Appreciate it.
Our next question is from Nicole Swanson from South Central News. Your line is open.
Thank you, and thank you for taking my call. I guess one of my main questions is, out of the 3,086 breakthrough cases in Minnesota, how many of those have been of the Delta variant?
I can take that, and I'll just explain that, we are not able to sequence absolutely every single case that, that we see. So in other words, not every single breakthrough case that's been identified has been sequenced. And so what we're seeing in terms of the variants and the proportion of our breakthrough cases by a certain variant, it really fits with kind of what we're seeing overall with what's circulating in the state. So in other words, when Alpha or B117 was the dominant variant that was circulating, then that was more common in our breakthrough because that was really what was circulating. And now we're certainly seeing that Delta variants are contributing to the breakthrough, but then that is the dominant strain that's circulating right now. So what we're seeing with our breakthrough cases has reflected what is being seen across the state.
So what percentage of breakthrough cases are genetically sequenced then? Or tested to see what variant, what percentage of those breakthrough cases?
Probably about, 20% roughly. 20 to 30% are able to be sequenced, so a limited number.
So how does that, go ahead.
Oh, I was just going to say, this is Jan. Chris, you might want to say a little bit more about why sometimes we can't sequence, but I think we are doing a lot of sequencing in Minnesota, and that's an important part of our strategy. But we know we're not going to sequence every single case, but to get a really strong, solid sample that lets us kind of extrapolate from there. But Chris, maybe just explain a little bit what some of the barriers to sequencing or the challenges are.
Sure. So first of all, not every type of test can be sequenced. So someone who's had an antigen test, we can't do sequencing. And then for those cases where we are able to sequence, in some situations, there's not enough virus present on the specimens that we receive to be able to successfully do sequencing. So we get specimens in for sequencing. We work with a number of labs, and in fact, we've increased our requests for specimens to do sequencing. And as the commissioner said, we in Minnesota have done probably as much or more sequencing as any other public health lab in the country when it comes to looking for variants. But yes, not every single specimen are we able to sequence, or do we have access to a specimen to sequence?